if somebody listening to this desires to get breast implants, what should be best practices before embarking on that journey to make sure that they're stacking the odds in their favor?
Right. So I think I get asked, do I have a test that can identify who's at most risk? And there isn't currently a test that identifies who's at the most risk. When I look at your genetics and your toxicity, I can give you better thoughts about, okay, doing these things will help you keep your inflammation down. Now, when it comes to picking and choosing what surgery you're going to have, if someone wants to have a modest enhancement, they have to, entertain fat transfer as an option. So that's your own tissue, your own genetic material should have the least amount of reactivity and problems, especially, say, someone who has a history of autoimmune disorders in their family. Maybe they have lupus or Sjogren's or something like that. Like, you should always be thinking about, like, you can't outrun a bad family history. Like, you can't outrun bad genes. So if that's the hand you've been dealt, you need to think about that. If you're going to go up a cup size, two cup sizes or higher, then that's typically the purview of an implant. And then you have to have a discussion about placement, like we were talking about earlier, above or behind the muscle. And the bigger you have in terms of implant, the more often that's going to be behind the muscle to help camouflage all of the surfaces. But if it's just a modest one and they can do it above the muscle, behind the breast tissue, then that can be reversed or explanted more easily down the road if that ends up being an issue. In terms of breastfeeding, we don't have any data to support there being a problem with that. I think we talked about like bacterial colonization, and that's just a problem, just in general. So that being said, the safety and efficacy of implants needs to be, I would say enhanced always. It'd be great if they could reduce the ability of them to develop biofilm by adherence, but they're not going to go away. Just like a hip implant, a knee implant, a dental implant, a cardiac implant, none of those implants are going away. They need to just get better, and then people need to make better choices or have better discussions about the choices to make.
Yeah, of course. Does a surgery like a breast lift with no implant or fat transfer pose any kind of health risk?